My name is Alexander Lubichansky. I'm clinical librarian at the University of Nevada, Reno School of Medicine. And today we'll have a brief overview of Embase. So what is Embase? And our agenda would be to have a little bit overview, and maybe to check out some interesting search options, such as Quick Search, Pico Search, PV Wizard. And along the way, we'll look at the Embase filters. Now, what is Embase? It's an Elsevier database. It's a proprietary database that covers basically the same subjects as Medline and all the indexed information in Medline. It additionally includes 6 million records that are not covered in Medline. And Embase has a great conference abstracts coverage. They have over 3.6 million abstracts from conferences. Additionally, they have excellent coverage of European journals, and that's why oftentimes people informally call it European Medline. Embase is a great resource to search for drug-to-disease relationships, drug-to-drug interactions, adverse events, medical device information, a lot of information on pharmacology. And for people who do research, particularly systematic reviews, Embase is a go-to source. So I will now go to, I'll go to my, can you see my Embase here? All right.
Yes, we can.
Okay. So when you click on, I clicked on Embase link from my library. And when you click on it, the default screen is immediately so-called quick search. But as you can see at the top here, there are different search forms or search options here. So we have a quick search, we have Pico, PV Wizard. You can search by medical device, you can have advanced search, you can search by drug, you can search by disease, citation information, and so on. Now, for those of you who are looking at this M3 word, M3 is basically their controlled vocabulary or thesaurus. It's incorporates the same terminology as mesh, but it has much more because they have their own terms there too. So how this broad search works? So basically you can just type a word here. So I started typing diabetes, and it pulls the correct terms from subject headings from M3. So I'll click here, and now I want to add field. So suppose I want to look, it gives you options. You can add title or author's keywords or abstract or whatnot. I'll stick to broad search, and I will say I want to look for heart attack. And for heart attack, it suggests to use their term heart infarction. So I put it here, heart infarction. And at this point, I want to add another field. And this time I want to add different field, country of journal. And I will say United Kingdom. By the way, you have, if you do sentence phrase, you have to put quotes or double quotes, doesn't matter. I don't know if you were paying attention, but as I was adding these different search terms, the results at the bottom were changing. And I like this feature very much in Embase. You know right away how much you have here. Now, at this point, I can even add limited. So let's suppose we want to limit it to publication years, maybe 2000, about 2020 to 23. And we have still 3000, and I want meta-analysis. So I have 170 results. Now notice here, it says display full query. If we click on these words, we will see our search as Embase interprets it with field codes. So for example, BR stands for broad search, CY stands for country of journal, and so on. And we have our limits here too. At this point, if you're working on Embase, you can copy this query and then paste it somewhere else or use it in the future or save it. So let's click on the show results. So when you look at the results, you see this incredible search history you have created. Look at this. Look how complicated it is. And by the way, it allows you, when you point your cursor on it, it becomes blue color. It allows you to edit it. If at this point you want to remove something, some parts of it, or add something, you can do that. It allows you to do it. Now on the left-hand side, so your results will be further down here. And you can look at the abstracts. You can actually say show all abstracts, and it will show you all the abstracts. And on the left-hand side, you have filters. And I mentioned in the beginning that we'll be talking about filters as we go along. So one of the first filters here is the sources. If you click on it, it shows you how many items are indexed in Embase only, and how many Embase and Medline, and how many just Medline. This is a neat and useful feature. Now it also gives other filters like drugs, diseases, devices, floating subheadings. And notice that unlike PubMed, it has study types and publication types. And by study types, they have meta-analysis, systematic review, and so on, control study. And by publication types, it would be article or review or note or letter or editorial. So there is a difference there. Now, interesting feature, and that I wasn't planning to show it to you, but I will since we're on it. At the very top, you have this select language. I can actually translate all my abstracts now into whatever language I want to. So here all my abstracts are in Hindi. And you can change it to any other language and read it. So I will change it back to English. That's a nice feature, useful feature. So now let's check some other search options that we have. Those of you who are doing systematic reviews or are planning to do systematic review or helping people with systematic reviews would really be encouraged to use Embase in addition to PubMed and other databases. And here you can build your PICO framework. And for those of you who are not familiar with it, PICO is abbreviation for the formula that people use when they're preparing their clinical question, where P stands for population, patient, problem, I stands for intervention, C stands for comparison if there is one, O stands for outcome. And here, Embase also allows you to introduce study design here. So you can build your PICO framework here by typing search term. You can type it right here, right on this line, or you can type it here and let the M tree thesaurus find you the correct term. So suppose we're still looking for our diabetes, and we pick the right term, and look here, it offers you to add 3 synonyms. This is a great feature in Embase. So I click on synonyms and they pop up on the right-hand side. So if at this point I want to remove any one of them, I'll just unclick here. All right. Sometimes you have many synonyms, sometimes you have hundreds of them. So now I will type intervention insulin. And here we have 30 synonyms. I can add them all, or I can skip them. Suppose you add them, and in this listing, you might want to decide to remove something. You can take it out. That's how you do it. So from 30, you went down to 28 now. So I'll leave all 30 for now. So suppose we want to compare insulin with metformin. Metformin, it has 133 synonyms. I will skip it this time, it's too much. And the outcome we're looking for is cardiovascular risk. Cardiovascular risk. By the way, I like M3 very much because it has so many additional terms. Additional, I mean, in addition to mesh. So here we have 2 synonyms. I will add them. And all along as I was typing this, the results were changing here. So now I want to say that I'm looking for systematic review. So I have 278 systematic reviews. Again, you can see how complicated the search was performed here. And at this point, you can change your study types. You can add your publication types. You can change the dates of publication. Maybe you want to limit it to just 23. And then you click on apply. And you have only 12 systematic reviews. And oftentimes your term will be highlighted here, as you can see in the title. Now, in addition to abstract, Embase provides you with index terms. That's kind of a useful. Just like in PubMed, you can see similar records. You can sort it by relevance. You can sort it by publication date, by author, by entry date. You can view it, you can export, you can email it, you can add it to clipboard. So there are some additional features here. And needless to say, if you have created your own account, you can manipulate your results in much more in a wider way. So this is the search for PICO. Let's see what else Embase has to offer. I mentioned to you that there is PV Wizard, and this is pharmacovigilance. So this is when you look for adverse drug reactions, drug toxicity, drug interaction, maybe drug comparison, drug combination, and whatnot. So let's see what we want to look for. I think I had some drug in mind. Well, we can even use metformin as we used before. As you start typing here, Embase shows you all possible combinations or all possibilities for you. So that's the one I'm looking for. And here's your tree, M3. Remember tree and mesh tree? Well, here's M3, and it shows you all the way it's organized. So I will say, look at this. It shows you 9,693 results already. And I will stick to this adverse drug reaction, drug toxicity, and drug interaction. I'll stick to these subheadings, but you can always remove them or add the others one. So now I click on next step and look what happens. And next step offers me alternative drug names. And there are 133 variants here. And it says 133 variants have been added to your search. You have option to add more alternative drug names if you know. And by the way, the ones that were added are all here on the left-hand side. If at some point or for some reason you want to remove one or two or how many of them, you can just unclick them here. So I go to the next step. And now look at this filter. Isn't that interesting? So they created this filter already for adverse drug reactions. So they included here all possible cytotoxicity, infertility, and substance-related disorders, and chemical-induced, just name it. Remember the time when we had to do it all by hand, and here they already have it. So the next step, I'm going to special situations. And here you'll find a variety of special situations that they included in this filter. You have drug abuse, and you have infertility, and pregnancy, and lactation, and manufacturing problems, whatnot. So now I look at the results. I have 68,000 here. Next step, I can limit it by publication year. So I will say 23 to 23 because that's more than enough for me for now. And all along, you can see your search details on the right-hand side, which is very useful, very useful. You can actually click and see your full strategy here. Look at it. Isn't that amazing? It's just amazing. So now I click on results, and it always limits to human here. And here will be my results. Here are my results. All right, so this is pharmacovigilance wizard, or PV wizard. So let's go back to Embase and look at something else. I promised to you to show you medical device. Now, medical device, you can add device name or click here. And here you have an option. You can type the name here if you know it. I know what I'm looking for. I can type here arrhythmia detector, but suppose I'm not sure. So I will go to medical device and look for cardiovascular equipment. And here I will look for something else and so on. Or I can just type arrhythmia. Arrhythmia detector. Okay, and now I add it. And here it offers me to add 3 synonyms. And I say, sure, I want to see, and I'm looking for adverse device effect. I can switch to just device comparison, compare it with something else or clinical trial, but I'll stick to this. I'll say, so here are my synonyms. If I'm happy, I'll accept them. If I don't like them, I don't have to accept them. I can add more synonyms here. I'll say just add this 3. You can add another device. You can build quite complicated search here, but let's stick to what we have now. And we'll say, all right, we have 149 results. Maybe we want to limit them to maybe past 3 years. So we have 59. Again, as before, you can display full query, see how you did it. You can copy it and save it and use it in the future. You just copy and paste in your search, and that will save you time. So when we click here, of course, again, we see all our results here. So here are all the results. Great resource. Now, here, remember, I keep admiring M3. Well, you can actually search M3 just by itself. So here's a link at the very top. So you can browse it, or you can search within M3. You can go to, I don't know, you can go to diseases and look inside diseases, physical disease, and inside, and you have 25 million records here. This is incredible. And what I like about Embase is when you do search, and I probably should show it to you inside the, maybe inside Pico. You have this option here. Default strategy is always explosion. And when you do explosion, it searches your term or maps to preferred entry term and related narrower search or children searches. But you can always change it here. I should have mentioned it at the very beginning. You can always change it. You can change it to major focus. And let's say, let's change it here. And you can, you can change it to as broad as possible. And in that case, it will look for keywords and all kind of mentions. So I can change metformin as broad as possible too. And maybe our results will change. And this one, I might say, I wanted explosion and major focus. So we already lost a couple of results here. And this one, we can say as broad as possible. So look at that. Look, we got another 100 results here because we use as broad as possible. So that's why people like it when they prepare for their systematic reviews, because you have so many options for searching. And you can apply the same approach wherever you do, whether you do Pico or quick search, or you do your advanced search. Let's have a last look. Maybe we have already 12:22. Okay, let's check how
Alexander, real quick, there was one question in the chat real fast. Sorry. They asked, can you archive your history so that you don't have old unrelated searches listed before your results?
Yeah, you have to create your account, and then you will use your My Tools. Okay. You can use My Tools and you can save your search history. You're right. Yeah, you can do that. Let's look at this for a second. So you can search for disease here. And when you do acute otitis, okay, let's suppose we use, it says acute otitis, use acute otitis media. Okay. So suppose you're looking for acute otitis media, and I'm in disease search. You have interesting options here right away. So first of all, you can look at the mapping options. You can map it right away to preferred term in M3, and this is default here. It's clicked already. You can search also as a free text in all fields. You can add it. You can search as broadly as possible. You can add it, or you can unmark them all. You can right away establish what dates are you looking for. You can also look at the sources. Maybe you want only Embase. I don't think there will be much there. I'll say maybe I want just Medline, not Embase. You can look at your fields. You can add fields. You can do disease subheadings. Maybe in acute otitis media, all you're interested is drug therapy, or maybe you're interested in diagnosis. And look at this. You have your Boolean here right away, this or that. Is it nice? Yeah. You can also put quick limits here and say, okay, God forbid, I don't want any animals. I just want humans. And I want only in English. Look how it saves you lots of time. And on top of that, you want to say, I want systematic review and randomized control trial and meta-analysis. I don't think I'll have many results here because I limited it. Let me see, maybe we should increase the date. And we already limited to English language. We can limit it to publication types and search. And we got 168. That's not bad. So here's all good. Now, by the way, they are all sorted. Default is by publication year. Remember that in PubMed, it's always by relevance default display. Here it's by publication. So if you do relevance, it will be kind of slightly different. Now you see the most relevant ones. And you see they're highlighted. Oh, it's my alarm clock tells me that I'm getting towards the end of this presentation. Are there any questions so far besides the one that we answered? How do you like it? Look at this, amazing. Isn't it amazing? Anybody has any comments? Anybody has anything to add? Because I'm sure there are people who use Embase and probably know more than me. I like filters, you know, there's so many filters. Remember this conference conference I told you about? Let's see. I want to see if there are conference abstracts here. Yeah, I wanted to show you example of conference abstracts. So you can, if you decide that you want only abstracts from this particular conference, you just click on apply and you will see that. I don't think you'll be able to see this. You don't have this feature in PubMed. Isn't it nice? Here's all your conference abstracts. Here's your abstract. Here's your abstract. Well, I guess we have come to an end. And if there are no more questions, I probably should wrap it up. And I should tell you that, okay, I need to go forward. I should tell you that there is a there is a link here that you can click and tell us how we did and provide feedback. And please be on the lookout for the next workshop. And the next workshop will be in September. And there is also Scholarly Snippets YouTube link here. So I hope you will join us for the next Scholarly Snippet presentation. Thank you very much. And I guess I should say goodbye, everyone.
Thank you very much for all of that.
All right, thank you. So we can sign out, Raul, right?
Yeah, if nobody has any other questions, I don't see anything in the chat. I think that's a wrap then.
Well, thank you all. And if you want to provide feedback to me personally, I'm at Savit Medical Library, University of Nevada, Reno School of Medicine. You can find my email there, my contact information. So anytime. Thanks a lot and goodbye, everyone.